Welcome to Health in Retirement. Each week, we'll discuss some of the health challenges facing retirees. We'll focus on more than just physical health. We'll look at financial health, mental and emotional health, as well as spiritual health. With your host, Rebecca Jones. This is Health in Retirement.
Hi, and welcome back to Health in Retirement. I'm Rebecca Jones, and I'm joined here today with Alicia Butler. She has been a part and is an advocate for safe families for children.
Mm-hmm.
And I mean, when I met you, I was just blown away by the need of this program for families. Can you tell us a little bit about it and maybe how and why it got started?
Sure. Thank you so much for having me today. It's an honor to be here with you. So Safe Families for Children was started in 2003 in Chicago area by a child psychologist who was working with a client who shared her story about how her daughter had been taken away from her and put into the foster care system.
Oh my, and that's like every parent's worst nightmare.
Yeah, absolutely. And I mean, obviously it's a problem throughout our country, and even here in Sedgwick County and in Kansas. And so he said, as he was hearing her story, he, at first was kind of angry with the mom, like some of the choices she'd made and not understanding her decisions. But then she kept talking and she said, if I had only had somebody that I could call when I was in this moment of crisis or just a need. A need. And that really awakened in him this thought of what if we could organize volunteers in our communities that would come alongside families that were in need. A lot of us are in need in lots of different ways.
Exactly.
But a lot of people are socially isolated, and they're in communities, they either by their choices or maybe even just life situations, they don't have people they can call. They don't have people they can count on when they're in the midst of raising their children. And so a lot of times they make a poor decision that leads to a poor decision. And then they find themselves in a place that they never wanted to be or thought they would be.
Right.
And our founder, Dave Anderson, who started Safe Families for Children, he really believes that children should be with their parents if at all possible.
100%.
Most parents are good people that just, have life situations that come up. And as I mentioned before, they find themselves in places that they didn't think they would be. So he said he went to the head of the welfare system for the state of Illinois and presented this idea. What if we had, families, people that are in the communities that are volunteers that we match with families that have needs, and we, kind of step in and become family for those people. We become safe families for children.
Yes.
And we come alongside, we walk with the parents, we mentor them, we build relationships with them, and then we can host their children. And so that started in 2003, and now we have chapters all over the United States. We have some in Canada, in the UK, and actually we even have a chapter in Hong Kong. So this movement, this volunteer movement of people stepping up in the communities and just showing compassion and generosity and hospitality to others in the community is growing. And we actually, in Wichita, we started in 2021. Yeah, last year in March, just coming out of the pandemic. It was kind of a crazy time to launch a chapter.
Oh my gosh, yes,
absolutely. And so last year was a lot of fun. We learned a lot, but we had an amazing group of volunteers locally. And they, just came up and said, hey, we're willing to serve in this capacity. And so that's kind of how we started here in Wichita. And here we are, a year and a few months later, and we have hosted lots of kids in our first year. We also have built some what we call family friend relationships, which is when we pair volunteers up with just being a friend to families.
Honestly, I mean, it's like that saying goes, and it's so true. It takes a village,
Right.
And I think if we can just normalize needing help, wanting help, because there's people out there that want to be the help. It's a gift to help.
Right. And it is hard to believe. We had a situation. It was actually a grandmother who had custody of her children, and she called and was asking about what Safe Families does and how we could help serve her. And she said to me, she goes, "Now, how much is this going to cost?" And I said, "No, it's free. Like that's what we do. There are people that want to do good things, and they want to come alongside families, and they want to support them, and they want to love them, and they want to just even be a resource for them. Sometimes we don't know what we don't know. And, sometimes you just don't know maybe some of the resources that are in our local community that people, have access to that they don't know."
Exactly.
So that's part of that family friending, is just even like saying, "Hey, did you check out this? Did you look at this? Did you know about this?" And, maybe you're new to town and you don't know people. Maybe, and this was the situation that I was talking to you about. It was a grandma that was new to town, and she didn't have the resources in our community yet. And so, we love being in that space.
Right. So I can tell that it's not just being able to like host kids. It's so much broader than that. There's so many ways that you can help. If you're listening to this right now, I mean, you are a wealth of knowledge, and just to be able to bring that to someone else and be a support system in various ways.
Absolutely. One of the things we talk about as an organization is anybody can be involved in this volunteer movement. So, traditionally, one of the things that we focus on is hosting children in your home. Right. But really, that's not all that we do, and not all that we facilitate. It's so much more than that. And there's so many people that can be involved in that process. And I'd love to share more about that.
Yes, I can't wait to get down into some of the stories and just the great impact that Safe Families for Children is having on our community, just banding together and helping each other. Can you share how people can get a hold of y'all really quick? And then
Sure. We have a website for the state. It's kansas.safe-families.org. And then there's also a national or a statewide intake line, and it's 913-933-3357.
Awesome. So we will be back, and we'll talk more about Safe Families for Children with Alicia Butler, and we'll be back right after this. Hi, and welcome back to Health in Retirement. I want to bring you those topics that's going to help make your retirement living fulfilled and enjoy it to the best of your ability. And one of those ways is to be able to give back to the community. So that's why I asked Alicia Butler on the show today to share with us Safe Families, care for children. One thing I was talking to you over break was the fact that, a lot of times retire people, as you're entering retirement or you're retired, you kind of lose that sense of purpose, because you're going to work, you're doing those things on a daily basis. And then it's like, well, now what? But you still want to be able to give back to the community in a way. And I think that's what you can bring to the table here.
Absolutely. One of the things that there are so many young families, young moms, people in our community that just need a friend.
And I can attest to that. I was a young mom with 4 kids and, like you said, moving to a new town, nobody, to even have kind of like a parent-ish guide, just someone with that knowledge who has experience to guide me.
Somebody who's raised kids before, somebody who has lived through life and has experiences and a wealth of knowledge that they could offer younger people, maybe even teen moms or young moms that have never experienced just life before. That is one thing that we try and facilitate facilitate as safe families for children. In addition, like I mentioned before the break, to hosting children, which a lot of people don't feel that that's where they're called and that that's something they can do. Totally understand that. We have a program called Family Friending. And it's like I said, it's more, we do mentoring, kind of, you're paired up with a family who, there are people who call our intake line and they tell us, I just need a friend. I just need somebody. Maybe you just call them once a week. You just ask them how their week's going, you know, what their challenges are. You know, you can.
Or just come and sit with them and have a cup of coffee.
Yeah, or pray for them, or, you know, offer to, you know, give them some advice on parenting. And I just think that there's a wealth of opportunity in, there's people in the community that need friendship, need love, need concern, and there's people that are willing to give it and have the time.
Exactly.
Have the resources to do that, have the experience to do that. And so we would love to continue, as we continue to grow as a chapter here in Wichita, we would love to continue to facilitate those kinds of friendships and relationships. And, you know, you don't know some of the things that you do, you know, just little things that you do, what a big impact that could make.
Huge.
If I could share a couple of examples.
Please do. I would love.
We had a mom that was a young mom, and she, you know, she wasn't really sure, you know, just even things like feeding her baby, like what to feed her baby, you know, that, you know, at a certain age, babies start crying at night because they're hungry and they need more food. Maybe you need to be
on how to start that, you know, into the solid food stage.
Right.
You know, we expect parents to, you know, you just have a baby and all of a sudden you're just supposed to know.
I know. They send you home from the hospital and you're like, here's another human that I have to take care of. And so, you know, just sitting down and saying, well, have you tried cereal? You know, have you, you know, how's the feeding schedule? You know, are they taking naps? You know, things like that. Just being a sounding board for that mom, you know. And then, you know, there's a lot of other, you know, sometimes it's resources that people need, you know, maybe it's a pack of diapers. And, you know, of course, right now we're going through a formula crisis. Oh my gosh. And, you know, supply chain issues. And so, you know, sometimes it's even being creative with that and saying, well, have you thought about this? And have you ever tried that? And so I think so many people, I don't think we realize right now, maybe we are realizing it coming out of the pandemic, that there's just a lot of people who are isolated and feel alone and don't feel like they have anyone that they can turn to. And that's, you know, that's putting some emphasis on the mental health of our community as well. Sure. And I mean, you know, we all know that there are issues, but I think so much of my life is, you know, realizing that we just need to be in good relationships with other people, and that there are people out there that want that and that need that and are asking for it. And so that's one of the roles of Safe Families too, is just to facilitate those kinds of relationships. And when we find out that somebody's in need, we can match them with somebody that might be willing to fill that need. Exactly. You know, and help them.
And to be needed is also a gift.
Absolutely.
You know?
It gives you purpose. It gives you meaning. It helps you live an intentional life when you realize it's, you know, I can help.
Yes,
you know, pay it forward.
Yes, we are bigger than just ourselves.
Exactly.
And,
exactly.
I just love this program and what you bring the community. If I was wanting to get involved, or if one of our listeners, it can kind of sound a little daunting to, like, you know, well, what kind of like rules and regulations, what kind of process is it? Is it hard, or, you know, is it something that, you know, why not just sign up and, you know, even if all you can do is be a listener to someone, then I think that's great.
No, it's actually really easy. The volunteer process, we direct everybody to our website, and there is a button on there where you can just sign up to be a volunteer. And like I said, there's so many different ways you can get involved, but once you go ahead and sign up to be a volunteer, then there's options on how we could plug you in.
Okay.
And so that's through our website, and you. So you do that, and it really is pretty simple. Depending on what kind of volunteer you want to be, we have different requirements. So,
Of course.
obviously, if you're hosting children in your home,
Mm-hmm.
we require a background check and fingerprinting and a little bit more training
For sure.
to become a host, which is,
But at the same time, I can imagine that is just such a gift. And I remember you talking about when I met you, how it, after, host families are matched and then they just become lifelong friends.
Yeah,
like a foster grandma or something,
Yes, absolutely. And that's our hope. That's our hope that we're building these family networks, that continue on and that the legacy of just that friendship and that connection can make a difference in generations to come. And so, that's a beautiful picture of how we all in a community can help each other out and help each other grow.
And just to know that you were a part of being able to keep the children
safe.
Yes,
and
safe
and together
with the family, and just the amount of stress and relief that you could bring the mother or the father involved that is needing that care.
Yeah.
I mean, that's going to impact that family. Literally, it will change the trajectory of their entire life.
Yeah, our motto is children safe and families together. And, we would welcome any volunteer that would like to be part of that process and helping to transform our community.
It's going to be beautiful. And how can they get a hold of you one more time?
So, one of the easy ways, I thought I gave you our statewide number before the break, but I'll just give you my number, my personal number.
Awesome.
And then that way we can get you plugged in any way that you might want to volunteer. So again, I'm Alicia with Safe Families for Children, and my phone number is 316-217-1096. That's 316-217-1096. And I would love to talk to you about getting involved in this volunteer movement.
Awesome. Thank you so much, Alicia.
Thank you.
And we will be right back after this with our Market Medicare advisors.
Now, our health tip of the week.
Hi, I'm Rebecca Jones, and this is your health tip of the week. Today, I would like to talk to you about mindfulness meditation. Have you ever tried meditating before? Let me tell you a little bit of the benefits behind meditating. It definitely lowers your cortisol levels, stress, anxiety, and even blood pressure. And the key to meditating successfully is to know that there's no right or wrong way to do it. So if you're in a safe space right now, I would like to take us through a quick mindfulness meditation. Go ahead and get comfortable, and if you're able to do so, close your eyes. Sink into your body, feel where you're sitting, focus on your breath, in and out. You can even count your breaths. It helps me if I count my breath 4 in, hold at the top for 4, breathe out for 4, and continue that way. If you find that your mind is wandering, you just want to stay in the present moment in your body. So I challenge you to meditate morning and night and see how it can greatly impact your life.
For more health tips, go to healthinretirement.com. This has been your health tip of the week.
Hi, and welcome back. I'm Rebecca Jones with Health and Retirement, and I'm joined here today with Cory Hiebert. He is our Market Medicare advisor. We can't talk about health in retirement without talking about Medicare. It goes hand in hand, right?
Yeah,
so,
absolutely.
Welcome, Cory. I do have to say, I went to a lunch workshop that you were holding, and I didn't even realize how much information there is to take in with Medicare. And you are a fountain of knowledge when it comes to Medicare. And So I learned a few things, so I did have a few questions if you wouldn't mind answering those for me.
Yeah, well, those lunch workshops are great. They're a really good way to kind of start that Medicare discussion. We only run those for an hour, and there's a lot to talk about when it comes to Medicare in general.
Yes.
And even specific circumstances that you're under. So I try to get as much done in that hour, but of course people do have questions. So what did you come up with?
So one of the people, actually, it wasn't my question, but he brought up a pretty good point is, what if you have moved? So you're in Medicare and maybe you're going to move in with a child, or a caregiver out of state, or you're just moving and, maybe it's time to go to Florida, for retirement. And how does that affect your Medicare?
Yeah, absolutely. That's a great question. There are certain Medicare plans that are completely dependent upon your zip code. For example, if we're on a Medicare Advantage plan, those work in networks with networks of doctors. So if we do move or change addresses and change that zip code, we've got the opportunity to make a change to our Medicare Advantage plan, even though we're not inside the open enrollment period.
That can be a bonus.
That could be a very big bonus because depending on which area you're in, some Medicare Advantage plans are just have better benefits than others.
Right.
The other big thing is that if we are moving, you do have the opportunity to change your prescription drug plan. Your prescription drug plan does rely on your zip code. It's not mandatory that you change that right away, but as soon as your information gets updated with the Social Security office, Medicare is going to come to you and say, hey, why are you still on this other plan? You need to be on a plan for your zip code.
Okay.
So yeah, it is important that whenever you are moving, you're paying attention to what is offered in your area.
So if you move, it might be just a really good idea to go ahead and see a Medicare advisor, make sure that you're on the right plan, that you can get re-enrolled in the network. Is that right?
Right, absolutely. And it is good that if you are working with an advisor and we move from state to state, it is important to know that where your insurance advisor can sell, because we are required we are contractually obligated in certain states. Here, I like to hold several states. A couple of the ones I do would be Kansas, Missouri, of course, Virginia, Florida, and Colorado. Those are some places where I've had clients move in the past, so I like to be able to help them.
That's awesome. Yes, so you're there with them every step of the way, whether it's move or a health issue. You're going to be there. You're going to be their advocate, making sure that it's going to best fit them. And how can they get a hold of you?
Yeah, you can reach us at 316-867-4MED. That is 316-867-4633.
Thank you so much, Cory. I appreciate you being on here today. And this has been your Health in Retirement, where we care about your biggest asset, your health.
This broadcast is intended for informational and educational purposes only. The views, statements, and opinions expressed herein are those of the individual speakers and not necessarily those of Foundations and its affiliates. The information contained herein does not constitute an offer to sell any securities or represent an express or implied opinion or endorsement of any specific investment opportunity, offering, or issuer. Any discussion of performance or returns is not indicative of future results. Each individual investor situation is different, and any ideas provided may not be appropriate for your particular circumstances. Foundations only transacts business in the states where it is registered or is excluded or exempt from registration requirements. Registration as an investment advisor is not an endorsement of the firm by security regulators and does not mean the advisor has achieved a specific level of skill or ability. Legal services are offered by Eidelman Law Firm. Tax services offered by Market Tax Services. Market Advisory Group does not provide legal or tax advice. Investment advisory services are offered through Foundations Investment Advisors, LLC, an SEC-registered investment advisor.